Hi, I'm Marco and this is Ashley. We are the clinicians and this is our program on how to prevent carpal tunnel syndrome for sedentary people, primarily office workers.
Our goals for this program is to prevent kyphosis, forward head, to have some hand strengthening exercises, and to maintain proper ergonomics in the workplace. Okay. For our first goal in our prevention program for carpal tunnel is to prevent kyphosis, and it's important to prevent kyphosis because for sedentary patients who work in the office place, they're constantly here in their arms for their keyboards like this. So we want to prevent this slouching and put it forward. And kyphosis is due to the tight muscles or the pec major and minor, while the weak muscles are the lower trapezius, latissimus dorsi, and the rhomboids. So we're trying to strengthen those muscles to prevent to reduce the lumbar curve and stabilize the core to help them keep their posture while they're sitting. So our first exercise is the patient will be laying prone, and then they're going to have their elbows onto the table, and they're going to extend their back. So they want to make sure this is at 90, and they're going to be doing that for 3 sets of 30 seconds.
So the next exercise is going to be prone extension in hands, and what we're going to have them do, we're going to have the patient lie prone on their tummies. We're going to have them go in a push-up position with their hands on the table, extending their back as far as they can go and just where they feel comfort. 3 sets of 30 seconds each.
Our next exercise, the patient will be laying prone, and what he's going to do is he's going to alternate his arm and his leg, so his arms are going to be kind of out, and then he's going to extend the opposite arm and the opposite leg, and then he's going to switch. This is really good to help stabilize the core, and he's going to be doing 3 sets of 30.
The next exercise is going to be standing extension, and what you want to do is you want to place your hands in the back, mid-back, where the lumbar area is. Have the patient extend only their spine area and try to avoid extension of the hips. Also with this one, you want to avoid shrugging your shoulders, or rounding your shoulders, sorry. Just have them in that good position, kind of retracting a bit. So this next exercise is going to be the bridges, and what you want the patient to do, lie supine on the table. You want them to flex both knees. And then with this one, you want them to hip extend, so having their pelvis go towards the sky, holding for about a second for each, and having their butt squeezed tight before going down for each one. You want them to do 3 sets of 10, and also this is going to help for core stability, strengthening the core, which will prevent kyphosis in the long run, prevent the flexion of the spine. The next exercise is going to be the scapular retraction. So with this one, we're going to have the patient sit on the Swiss ball. And with this one, you want them to to perform the scapular retraction. So with this one, you want them to also avoid rounding of the shoulders and retracting the scapula while pulling the band. We're going to do 3 sets of 10. This is going to help prevent the kyphosis and rounding of the shoulders, so strengthening posterior back muscles.
Our next goal for our prevention program for carpal tunnel syndrome is to prevent forward head. And forward head is when you have tight anterior muscles such as your scalenes and your sternocleidomastoid, and you have weak posterior muscles such as your splenius cervicus and your splenius capitis. And some of the exercises that are used to prevent kyphosis will actually help with the forward head as well. One of our exercises for forward head is chin tucks, and what we're going to do is we're going to put this towel on his head, behind his head, and then he's going to chuck his chin to his neck, and then he's going to push the towel to the wall. And he's going to keep that motion for 30 seconds for 3 reps. And he wants to make sure that his shoulders are back instead of rounded.
So the next exercise that we're going to do today is going to be call these a resisted chin tucks. So what you want to do is you want to have the patient put the TheraBand just around the back of their head, okay, holding the resistance there, and then tucking their chin into their neck, and do these 3 sets of 10. So these are going to strengthen their posterior neck sensors. So the next goal is going to be the actual prevention of the carpal tunnel syndrome. We're going to be focusing on some hand exercises as well as some stretches. We're going to be stretching both the wrist extensors and the wrist flexors with this. So that means we're going to be strengthening the grip.
Our first stretch to prevent carpal tunnel syndrome is the prayer stretch. And to do this, we're going to have the patient, they're praying, make sure that's down, and then they're just going to stretch, pushing their hands together. We want to prevent them from slouching while doing this. We want them to keep back, with also that encounters with the kyphosis.
So the next stretch is going to be to stretch the wrist extensors as well as the flexors. So for the first one, you want to be stretching your flexors. What I want you to do is I want you to stretch your arms, hold your fingers with your other hand, and pulling them back. So this will be stretching your flexors, and then the opposite side, flexing the extensors, holding both for 3 sets of 10 seconds.
Our next exercise to prevent carpal tunnel syndrome is tendon gliding exercises. And what we're going to do is you're going to have your fingers in an extension. Then we're going to go into a hook position, back up. All the fingers go down, the fingers extended still. Back into extension, and then we're going to have a full fisting, just like that. And we're going to do 3 sets of 10.
Now for this exercises, these are going to be the wrist extension and wrist flexion exercises. We're going to begin with a light weight, and we're going to begin with wrist flexion. All right. Strengthening those, we're going to do those 3 sets of 10, and then flipping it the other way around and working on wrist extensors using lightweight. There you go. 3 sets of 10 as well on those.
Our next exercise for carpal tunnel syndrome to prevent it is gripping exercises with the towel, where he's going to grip and he's going to go all the way, bring the towel up until he can crumple it all, or as much as he can. With this exercise, we can also use Play-Doh or pliers. Our next goal to prevent carpal tunnel syndrome is to maintain proper ergonomics in the workplace, especially in the desk area. We want to make sure that their positioning with the desk and the computer is proper. The proper ergonomics for the desk area is to make sure that this computer screen is at eye level. We want to ensure that their patient is not slouching, and so they're in an upright position and making sure that their shoulders are back. And then we want to prevent the wrist extension that is associated with carpal tunnel syndrome, especially with using a keyboard. We want to make sure that their wrists are on the table at a resting position so it's more wrist flexion in a neutral position than wrist extension. If the patient is not comfortable with resting their hands on the table, they can use a comfortable pad and then type while typing. So go ahead, and this prevents them from wrist extension as well. Next, for foot positioning, we want to make sure that the feet lay flat on the floor instead of under the chair.